This lecture is going to be on pancreatitis. The pancreas is both an endocrine and an exocrine organ. The islet cells primarily regulate glucose metabolism, and this will be further discussed in GI and Pancreas 2 lectures. The acinar cells make digestive enzymes, and those enzymes are then secreted into the duodenum. However, a small amount of these enzymes leak into the peripheral blood, and we can measure those enzymes for diagnostic purposes. The pancreas also makes and secretes intrinsic factor and bicarbonate, which do have roles in cobalamin absorption. Pancreatitis is inflammation of the pancreas, and it is most common in dogs, but it can also affect cats and rarely horses. The clinical signs are mostly confined to the GI tract and include vomiting, diarrhea, and a tense and painful abdomen. There are various etiologies that can incite pancreatitis, but the end result of those etiologies is the same, and that's autodigestion, meaning that the injured acinar cells prematurely release their digestive enzymes, and the enzymes digest the pancreas and the peripancreatic tissue. Here is a list of screening and confirmatory tests for pancreatitis. Routine testing, including a CBC chemistry panel and urinalysis, often show evidence of dehydration and inflammation. The inflammation and edema frequently extends to the tissues around the pancreas, and this results in compression and occlusion of the common bile duct, and therefore cholestasis. Hepatocellular injury may occur secondary to cholestasis or from direct injury from those digestive enzymes. Pancreatitis may cause hypocalcemia due to saponification of fat. And in general, pancreatitis causes all forms of energy to increase in blood due to a combination of stress, insulin deficiency, and glucagon excess. The most specific screening tests for pancreatitis are serum amylase, lipase, and the IDEX SNAP test called SNAP-CPL. While these tests are the most specific screening tests for pancreatitis, their diagnostic specificity is too low to definitively diagnose pancreatitis. So, to confirm pancreatitis, you have to run one of the confirmatory tests listed on the right. These are immunoassays that use antibodies to detect species-specific proteins in the serum. So if the test is preceded by a C, then that means that it's a test for canine antigens, and if the test is preceded by an F, then that means it's a test for feline antigens. Amylase and lipase are enzymes that digest sugars and fats respectively. They are primarily produced by the pancreas, but many other tissues also produce these enzymes, including the liver and the GI tract. When in blood, these enzymes are excreted by the kidney and can therefore increase with decreased GFR. In general, nonspecific tissue injury and decreased GFR causes a less than 3 to 4-fold increase in amylase and lipase, whereas more marked increases, so greater than 3 times the upper reference interval or greater than 4 times the upper reference interval, these increases are more specific for pancreatitis. Some pancreatic carcinomas can produce lipase and cause marked hyperlipasemia that exceeds 10 times the upper reference interval. Dexamethasone administration and widespread steatitis can also increase lipase concentrations. The SNAP CPL test is an in-house screening test for pancreatitis in dogs. It is a test for pancreatic lipase, meaning that it tests for lipase that is produced by the pancreas and not by other tissues. If the patient's result is lighter than the reference dot, so the patient's dot is here and the reference dot is here, if it's lighter than the reference dot, then pancreatitis is very unlikely, and the patient's clinical signs should be attributed to some other disease, and other disease should be investigated. However, if the patient's result is darker than or equal intensity to the reference dot, then pancreatitis is possible and you have to do further diagnostic tests to confirm pancreatitis. Serum PLI and spec PLI are essentially the same test, with the main difference being that they're offered by different laboratories. So PLI is offered by Texas A&M, but spec PL is offered by IDEX laboratories. PLI and spec PL both measure lipase that is produced by the pancreas and not lipase produced by other tissues. TLI measures trypsinogen produced by the pancreas. Therefore, all of these tests measure proteins that originate from the pancreas and can increase with pancreatitis. All of these proteins are renally excreted. However, trypsinogen is the only substance that increases with decreased GFR. Therefore, serum PLI and spec PL are highly sensitive and specific for pancreatitis, and they are both the best tests to diagnose pancreatitis. All of these proteins decrease with exocrine pancreatic insufficiency, but TLI decreases more consistently with EPI. Therefore, TLI is the best diagnostic test to diagnose EPI.